Good morning. It's Dr. Rutledge, and I thought I'd talk to you a little bit today about the different kinds of weight loss surgery. What kind of weight loss surgery should I have? Well, if you've decided, because of obesity and its associated complications, to have weight loss surgery, what are your choices and what do we recommend? Well, the most common surgery performed in the United States is something called the Roux-en-Y gastric bypass. And many people call it the gold standard. It's the most commonly performed, and lots of surgeons choose it as their first choice. The problem is, if it really was the ideal weight loss surgery, then everyone else would be happy that it's the best choice. Instead, what you find is just the opposite, that surgeon after surgeon after surgeon is busy trying to invent a better form of weight loss surgery. So, for example, right now in the United States, something called the lap band is very popular. Other things are surgeries like the Fobi pouch, the bilio-pancreatic diversion with or without the duodenal switch, and of course my personal favorite, the Mini-Gastric bypass. Another new surgery that's out there that's being considered and researched is something called the sleeve gastrectomy, and all of these types of operations indicate that the Roux-en-Y, although it's a good surgery, leaves something to be desired, to say the least. Let's just talk about that for a second. The Roux-en-Y does have a long track record, but it has some downsides. One is it has a moderate death rate. Two is the complication rate is fairly high. Bowel obstruction is reported fairly commonly in laparoscopic gastric bypass. Open gastric bypass done with the Roux-en-Y technique has a fairly high incidence of hernias as well as other problems and complications. Nausea, vomiting are big issues. Postoperative complications are so high that 1 in 5 people will be back in the hospital in the years after their surgery. So for the study from California, for every year that was studied, about 1 in 5 people was back in the hospital after their Roux-en-Y with a gastric bypass related complication. And then the other really disappointing feature of the Roux-en-Y is that it fails. That is, there's a fairly high rate of people regaining their weight, and it's not easy to revise. So the Roux-en-Y is not a bad surgery. Lots of people do well with it, but there's certainly room for improvement. A new popular choice for weight loss surgery is something called the lap band. And the lap band is great in that it improves on the safety profile of the Roux-en-Y. The disadvantage of the band is it has a very low effectiveness, so that over time, up to 50% of people fail. The initial weight loss is only so-so, and so the lap band, although it's somewhat attractive as far as an initial safety profile, has the disadvantage of not working very well. And if you think about it, basically it blocks you from eating healthy foods, and it allows you to eat junky foods like milkshakes and candy and pretzels and potato chips. And so overall, over a long period of time, it's not surprising that it leads to failure. Probably the most radical surgery, certainly the longest with the highest complications, the longest operating time, longest return to work, the highest death rate, is the bilio-pancreatic diversion with duodenal switch. Again, this was invented because of the failures of the Roux-en-Y, and the surgeons who operate and choose the bilio-pancreatic are wound up about how it's so much more effective than the Roux-en-Y. And indeed, it does seem to be more effective, for the trade-off being that it has a higher death rate, higher long-term complication rate. One funny area is the bilio-pancreatic diversion surgeons get very wound up over the fact that the bilio-pancreatic diversion, or BPD, leaves your pylorus intact, and that gets them very exercised. On the other hand, in thousands of our patients, the mini-gastric bypass patients who have no pylorus, they have never come to me complaining that their pylorus was missing. Another new technique is called the sleeve gastrectomy, where 90% of the outside edge of the stomach is cut away and thrown out. And new data on that shows, again, it's relatively safe, not as safe as the band, and about as effective as the band. So that's a new area. Overall, if you look at all these things, what we're really looking for in an ideal surgery is a surgery that's short, safe, successful, reversible, revisable, long-term durability such that you don't need to regain your weight years after surgery. And the mini-gastric bypass provides essentially all of those factors to patients who have it. The mini-gastric bypass has a low initial complication rate, high patient satisfaction, excellent weight loss, it's reversible, it's revisable. It allows you to eat pretty much as you please, It decreases ghrelin so patients are less hungry, and overall it's got an excellent long-term track record. Hope you'll look into it further at our website at clos.net or email me at drr, that's Dr. R, at clos.net. Have a great day and talk to you again soon.